Welcome, everyone. Thank you for allowing us to be here. So Benjamin is a smart maven. Benjamin's been on a journey, though, actually for about 25 years before he got here, because what I learned along the way is how to use data to solve big customer problems. And I found myself on the wrong team, frankly, where I was helping big pharma sell more prescriptions, but we weren't getting healthier and we were spending more money. I said, I'm going to put together a team. I'm going to solve this one. And so that's what we've done. We've got a great group of individuals, each with unique disciplines that bring a more complete solution to this problem. And it's overall, this is just a gigantic marketplace. It's the last biggest consumer-facing industry that does not provide transparency. And it's just screaming for someone to do something about it. I couldn't take it anymore. It's because things like this, where parents can't afford prescriptions for their kids, where we don't understand how much a cost will be before we walk into the pharmacy and we turn around and walk out. A third of prescriptions don't get filled. And the big one is that it's a very complex thing to manage chronic illness and medications. And the one thing that is all common with these, cost and complexity. So this is how we spend most of our money when it comes to prescriptions. A third of all the money we spend on healthcare is right here. And a bigger store, to Brian's point, having Amazon doesn't solve this problem. It just makes it a bigger store. Here's what really is at the root of the problem. I'm a data guy. I understand how to use that. What we couldn't get access to was the prescription data in the past. So what we did is we took HIPAA, which is the one everyone fears. We embrace HIPAA. What it allows us to do is help an individual. Permission-based access to your claims. It's all legal. It's all part of the plan. We already have a platform we use that has 250 carriers connected to it. With that, we get very rich price and prescriptions and procedures, all the detail of what a member actually pays, not what the inflated cost is. That's the missing piece. With that, we can use our IP, Benjamin, to proactively shop and identify high health risk and message that individual with what we call prescriptive engagement. So now you get a message from Benjamin that says they just found you $87 in potential savings at one of 80,000 pharmacies all across the country with the voucher you need to be able to use that right now. So Benjamin's always looking to try to save you money. It also identifies where you're at high health risk. And about 10% of the population is in this category. What I loved about this business when I started it was the whole premise of being able to create a win-win-win scenario, meaning we save the payer, we save the individual, and we get rewarded for doing that. So this is a great program we did for a regional health plan. This is one of the 400 we go after in the country. And with 112,000 school teachers and state employees, they were overprescribed. We helped de-prescribe them with our PharmD team of more than 400 doctors. And we were able to save that plan and those members. So they love this because it's complex and it's expensive. Saving money and getting healthier is a very good thing. It's an enormous market out there. We're focusing on the private insured, which is self-funded. That's about half of the market, and 70% are on high deductible health plans and need help. Our beachhead is the 100,000 we're going to focus on for prescriptions, and we're off to a great start. Thank you, Expert Dojo, for the recent investment. We've now hit our highest monthly recurring revenue. We're up 67% from the previous quarter. We've raised money in the past. We're going to be raising more because we're on a more important mission than just this will get us there. We make our money by, it's a beautiful, simple model. Our paid organizations, self-funded employers and or regional health plans pay us per month. The member, it's free to them. We make our money by saving the members money. So every prescription's used, every medication review that's done saves them money, and we make money on that. We like our little quadrant that we have the access to the data, the prices. That makes us very, very unique. Frankly, I think it will make companies like GoodRx envious, because what we have is a HIPAA compliant path that practically can find money. And we can work with all types of insurance, even individuals, and Medicare, which is very much on our horizon for the future. We have two proven go-to-market paths that have been working wonderful. We go after those regional health plans. We also work with organizations that have lots of members, like Delta Dental, individual members, millions of them. And we work with those that are benefit management firms, such as Business Solver right here in Des Moines, Iowa, with more than 16 million members. Our future will be direct marketing to the consumer through associations. So we're raising the capital right now to really grow quickly. We've got momentum. We're going to grow from 62K where we are now to 300K by June 1st of 2022. We needed the capital to build out our team and for marketing to do this. So we know that 2021 will be a good year. We'll double our sales, maybe more than that. But more importantly is 2022. With the product and the relationships, that's when our growth will take off. We'll be back to raise more capital at that point, either seed or Series A. We know the marketplace has never been better for this. Right now, there's a demand for healthcare like there's never been before, and we're wiped out on savings. We don't trust, nor should we, really organizations. Congress won't solve these problems, nor will big companies. It's a simple model that we've proven in other organizations like Honey and Even and Trim. Why not in healthcare? We're a great team to do this because we've got a clear vision. And the last point on this is opportunistic growth. With permission and ability to message, this is where we grow. It's a 1.5 trillion in shoppable routine healthcare. With the price information we'll have and the relationships, we'll be poised for significant growth at that time. So the market's ready. The employer and the employees are ready. The other thing is, I'm a big believer in solving problems that I care deeply about. This is a cause that's worthy. I'd ask you to consider joining us. We need the right organizations behind us to meet this mission. I appreciate your time so much. Thank you.